Hi, I'm Terry, and I'm going to go over your preoperative video conference today for liposuction and or an abdominoplasty or tummy tuck. In the mail, you should have received a black folder or maybe stopped by the office and picked it up. But this is your pre-op packet, and inside the packet, you are going to have your consent forms that you're going to sign, initial and date after you've reviewed this video. And also in it, you will find a checklist. And I'm going to go line by line down each of the items. And if there is anything you have a question about, we want you to leave it blank. Otherwise, initial. If you leave it blank, we do want you to call the office to get your questions answered. And today it is just going to be mainly the nursing care, and it's going to be for educational purposes. The first thing you're going to see in your packet is your cover sheet. That's going to tell you the day of your surgery. And then a few pages over, you will see it'll be highlighted in yellow, the time to be here at the office. You do come here where you had your consultation with Dr. Eds. And if you remember on your video with him for your consultation, he even gave you a quick tour of the OR. Well, it is here at the office, so this is where you come to. One thing we want to remind people that have sleep apnea, if you have a CPAP machine, do bring it with you day of surgery. We probably won't use it, but we just like you to have it with you in case when you're in recovery. And you may say, I haven't used it in years. If you have one, we do want you to bring it. As far as your allergies, sensitivities, you may not think of certain things that you would have listed. We just want to make sure anything that bothers you, we want to know about that, such as certain medications may cause you to be nauseated. Well, then we wouldn't give you that medication. But if we don't know, then that could be an issue. So just make sure we know of everything that you would have an issue with, whether it may not be a full-blown allergy, but if it is a sensitivity. And then it could be something as simple even as topical, like the latex. Let us know about that if you have an issue with that. Medications, you should have listed that in your on your encounter sheet, and Dr. Eds would have looked over that. But sometimes people don't mention certain things that they don't think is important. Everything you take is important, even if it's over the counter. If it's, for example, a weight loss medication, we need to know about that. Or a prescription weight loss medicine. ADHD, ADD medication, anesthesia is going to want you off all of that 30 days before your surgery. That can affect your heart rate and blood pressure, so it is a big deal. Blood thinners, you're going to read in one of the first sheets, week before surgery, week after surgery, stay away from aspirins, ibuprofens, herbal supplements, the oils like fish oil, evening primrose oil. Those things can cause bruising and bleeding issues, so we just need you to be off of those. In your packet, you will have an almost 4-page list of medication to avoid, but if you have any questions, be sure and call us. We do need to know, if it's not already on your chart, the pharmacy that you use. Address is good, but mainly we need the zip code. That's how we find your pharmacy. And either a week or 2 weeks before your surgery, they're going to send electronically your antibiotic, and it will tell you to start day before surgery. You're also going to get Zofran, that is for nausea. You may not have nausea, but if you have issues, you're going to need it right then, so it's always a good thing to have. Pain medicine, that is sent in day of surgery. Now, if for some reason your pharmacy says they don't have this that we've sent, just tell them we did send it electronic, and usually that takes care of it. As far as the pain medicine, most of that type medication can cause your system to slow down, which causes constipation. So Dr. Eds wants you to have an over-the-counter stool softener ready to go. It can be generic from Walmart, but the key is you start it when you start taking the pain medicine, but always follow box directions. That's vitally important. They do like you to call the office the day before surgery just to confirm your time to be here. If you forget, we're not going to cancel, but they do like to touch base. If you have surgery on a Monday, then if you think about it, just give us a call on Thursday. You have a shopping list in your packet, and several things will be checked on there. One of them will be HibaCleanse. That is an antibacterial liquid soap. If you can get it at your pharmacy, but I'm at Walmart quite a bit, so I always notice it in the aisle that has the alcohol and peroxide. It's a 6-ounce blue-green bottle, and what he wants you to do the night before surgery, morning of surgery, from your chin, and I say just go all the way down to your ankles because I'm not sure exactly where all you're going to have liposuction. Front, sides, back with a loofah in your shower just suds up really well. After you have rinsed off, you dry off and put nothing on your skin. No moisturizers, no sprays, no powders, nothing. It is a drying soap, but don't put anything on. Night before surgery at midnight, do not eat or drink. Morning of surgery, you're still not eating or drinking, but it is fine to brush your teeth, rinse your mouth out. No makeup the day of surgery, no false eyelashes, acrylic nails or gels, anything on your, or even nail polish. Your pointer fingers need to be the natural nail bed. Toenail polish doesn't matter. If you use or wear contacts, do not wear contacts morning of surgery. It is fine to wear your glasses if you need lenses. Clothing. With liposuction, this is, it's messy the night of surgery. So a couple things I'm going to tell you. For your clothing wise, just wear something that you don't care about. Because with the liposuction, what he's going to do is take an IV bag, he's going to have medicine in it, and he injects that into the fatty layer. Well, he may use 2 or 3 bags of IV fluid. What happens to that fluid? Some of it he'll suction out, some of it's going to absorb, and some of it is going to leak everywhere he does the liposuction. And that incision for liposuction, I could do this right here, and it's almost like a tiny little punch, and he will probably have 1 stitch over each area that he does the liposuction, so you're going to have drainage. IV bag is clear, but what's going to come out is red. You are not bleeding. It is absolutely normal. It is just messy, so you don't want to have anything that's going to touch your skin that matters to you, whether that be your clothes, your sheets, anything. And I'm going to talk to you about how to handle that in just a second. Your blood work, you will receive in your packet in order to get your blood work. And what he will check is your complete metabolic profile and probably a CBC. You can take this and go to any lab you want to. The thing of it is, we are required to put a code on the order. They won't draw your blood without this medical code. The code is cosmetic, so your insurance will kick it out. So especially if you're from out of town, call around and just ask them what they're going to charge out of pocket for the labs that we have checked. And I'll give you a reference. There's a lab very close to the office here. It's about a mile or a mile and a half down the road. They charge $35 for a CBC, metabolic profile, out of pocket. So that gives you a reference. And if you are local and you want to go to that lab, just let the office know and they'll give you directions. And I think they are open 7 days a week. And we can also tell you their hours of operation. Some people are required to get an EKG, especially if you are 60 or older, and then some medical conditions. If you have to get an EKG, the best thing to do is get it from your medical provider. If that is not possible, let someone here at the office know and they can work with you on getting an EKG at the best price possible. But there are just certain issues that one would be required, especially from anesthesia. Or if you needed a medical clearance, same thing. You take the form that we're going to give you and you take it to your provider. Say if it's a cardiology, for instance, if we needed a clearance from your cardiologist, they could sign and date it, fax it back to us, or a lot of times the cardiologist will do their own notes, 3 or 4 pages, and just fax it over. But if you need a clearance, that's important for us to have that before surgery. As far as anesthesia, it is done under general, and you'll meet your anesthetist morning of surgery. He'll come in, talk to you, ask you questions, and you're going to have time to ask him questions. And he's been with Dr. Eds for many, many years, and I think you'll feel real comfortable. As far as transportation, whoever it is that is with you day of surgery, they're welcome to stay here in the office. You are going to be here for several hours, so they're welcome to stay here, but they can also come and go get something to eat, hang around town. But when you get to recovery, if they're not in the office, they'll get a call or a notification, and that gives them about 45 minutes to come back over and pick you up. With liposuction alone, you don't have to come back until the next week, unless you need Dr. Eds. As far as activity, walking, with liposuction alone, yes, he wants you up walking, even a good mile the next day. I will say the more you sit, the stiffer you get. It just kind of takes you a while to get that working again. But liposuction is like if you haven't worked out in, say, 10 years, you go to the gym and do a hard Nautilus workout, and you're doing aerobics and some weights, you can imagine how you're going to feel the next 24 or 48 hours. That's liposuction. So you are super sore, but that walking is important. You're not doing power walks, you're not doing the brisk running mile, but just up moving is vital. Now, as far as that drainage I was talking about a little bit earlier, before you ever come to the office for your surgery that morning, you want to make sure things at home are prepared, such as if you're going to be sleeping in your bed beforehand. You can go anywhere you want, but if you're at Walmart, I've seen this in the shower curtain section. It's a little package, and the shower curtain's like an almond kind of beige color. Used to be, when I looked at it, it was 99 cents. It's probably $1.99 now, I'm not sure. But those are a couple of things you can pick up, or an old tablecloth. Just make sure it's very cheap, but you can lay that over your mattress or wherever it is you're going to be laying. And that will put old towels or old sheets on top of it. Just remember this, it needs to be things you don't care about. Now, from the bed to the bathroom, you can lay down just some towels. And in case you're walking, you might just get a trickle or a drip. I'm always ultra conservative as far as that goes. You just don't want to stain your carpet. But this drainage usually goes for a good 24 hours. There are usually a couple of spots right at the hip area. Those spots may want to go several more days, but usually most of that drainage is over with in about 24 hours. And as I said, it's red looking, so we don't want it to scare you or your family. That is completely normal, and it's mainly tumescent fluid that is what you're seeing. There is no dressing that you have to put on the liposuction. The next day when you get up, you're moving around, your radius is kind of limited until the drainage is eased up. But the next day when you're up, you're feeling okay, you're not fuzzy headed. It is okay to get a shower. In that shower, soap and water, you can clean your areas with that he's done the liposuction. When you get out, you can take a little antibiotic ointment on your shopping list, Bacitracin if you can use that. It's over the counter at Walmart. Just everywhere you see that he's done the liposuction, put a little ointment. You do not have to put a dressing on that unless, like the hip areas, I think like a light day panty liner works really good, or just a little mini pad, because of that drainage. Band-Aiders having to change it so often. So you may want to think about that. The garment that you're going to order in your packet, they will have circled which garment they want you to use and the style number. What you do is you call ClearPoint Medical. It's a toll-free number, and you want to call this several weeks before your surgery so you're not charged some crazy shipping charge. But it usually takes about a week to get to you with your garment that you're ordering, and they'll go over this with you on the phone, but make sure you take a tape measure. You want to measure around your hips, measure around your waist, and if they say you're kind of borderline going from one size to the other, always go up a size, because it seems to me over the years I've noticed they may run a little small, and we do want it to be very snug, but you do have to be able to breathe and get in it, so that's important. Bring it with you day of surgery. Usually they'll have you to wear it the day after your surgery when all that drainage has stopped, because otherwise you're going to take it off and have to wash it anyway. But after you get out of that shower, for sure, the day after, you get your garment on, and you're going to wear that garment 24/7 unless you're in the shower, especially those first weeks. And most of the time, he likes you in that garment a good 4 to 6 weeks. And then after that, he may tell you to, ease up on it a little bit. But it does help to, those little tunnels where he does the liposuction, it does help to compress those. So that will help in your overall shape. One thing too is, and I don't have this on your sheet, but it's just a little FYI. The week after surgery, if you try to put on your tight-fitting jeans, you're going to think this has backfired. It has not. That's just the tissue swelling that comes with liposuction. If you get on the scales the week after surgery, it'll look like you've gained 10 pounds. You have not. You just need to be patient and just wear kind of looser clothing. At your 1 month visit, they'll start weighing you again, and that's when you're probably going to start to notice the most difference. But I've heard him say over the years, liposuction, it is not an immediate thing, it is contouring. So at 3 months, you get 75% of your result. At 6 months, you get 95% of your result. So that's why they call it the contouring, and that it just takes a little bit of time. But just be patient with it, and if you're doing what you're supposed to do, and with the surgery, you're going to notice a difference, a good result. Now, infection, what would you look for? This is just what infection is. Pus-like drainage, temperatures going up, hot to touch, red streaks. You would call about that, and we do not see that often, but that is infection. If you run a low-grade temperature the night of your surgery, that is dehydration. You just need to increase your fluid intake. Sun exposure. It takes up to a year for a scar to fully mature. So during that time, if you went to a tanning bed, you're out at the beach, with liposuction, just make sure you use a really good sunblock over those spots where you know he's done liposuction, and you want to kind of reapply that at least every hour. Or if you're wet, sweating, you can even reapply it sooner. As far as sutures, everywhere he does that little punch for that liposuction, usually there's just one little stitch. There may be an area that you don't even see a stitch, and that's okay. But if there are stitches, they will come out at 1 week, at your 1 week appointment. As far as returning to work, most people go back, just within a few days. Your instructions probably say a week. With liposuction only, that's kind of a stretch. Just as long as the anesthesia is out of your system, you're clear-headed, not fuzzy-headed, and you feel like going back, then you can. And of course, you're not on pain medicine. And I mentioned the follow-up appointment, 1 week, and then they'll spread those out after that. And driving, again, it says 1 week, but with liposuction, this is the one surgery that he will let you use ibuprofen to take. But sometimes if it's a full liposuction, you are really sore, and a lot of times he'll give you something a little extra. So you just want to make sure you're not on pain medicine, it's out of your system, you're not fuzzy-headed, good use of your arms and legs, and he's okay with that. There is a form in your packet that goes with your consent forms, and it's the after-hours phone numbers. You have a copy that stays with you, and then one you will send back with your consent forms. There are 2 numbers that are listed. The top number is the office number answering machine. The second number is the answering service, and you do talk to a human being if you need that number. Over in your packet, right-hand side, the last single sheet, it says financial policy. If you'll look most of the way down, you're going to see cancellation. And that says, if you cancel surgery less than 7 business days from the date of your surgery, Dr. Eds retains $500. Well, what if it's the morning of surgery? You're supposed to be here at 7 in the morning, and you wake up at 3:30, you are sick, you have 102 temperature. What do? Do not leave a message. The surgery staff will not get that message in time. The front office staff is not here that early in the morning. So what I want you to do is call the second number. You make sure you talk to a person, and you tell them, I'm supposed to be there early morning to have surgery with Dr. Eds. I am sick. They said call them at home as soon as possible. They know when to do that. You will not get charged. That also goes for a family emergency and some crazy weather issue. Never assume it, always make the call. Then if it's after surgery, it could be nighttime, or especially Thursday afternoon, could be 5 or 5:30 till Monday morning, the answering machine is on. If you need something, you again call the second number. You tell them, I have just had surgery with Dr. Ed's. He said to call him at home if he is needed, and they are good about doing that. Revision surgery cost. This is something, let's say, for instance, you're out of surgery months down the road, 3 or 4 months. It could be 6 months, 8 months. If for some reason you had to go back to the OR, at that point, he still does not charge you his surgery time, but he does charge for the OR and he does charge for anesthesia. So that would be passed through to you. Now, if all you're having is liposuction, then you will just sign and date and then mail these forms back to us. If you are having abdominoplasty, which now it would be called lipoabdominoplasty, there's a few additional things that I do want to go over. With a tummy tuck or the abdominoplasty, he does not want you using any ice packs. He does not want you using any heating pad over the surgical area. And with the abdominoplasty, that always takes precedence over liposuction. So liposuction says walk a brisk mile the next day. Well, you're not going to walk a brisk mile the next day. You're going to be up moving, yes. But for instance, liposuction says shower the next day. Well, with a tummy tuck or the abdominoplasty, you will not shower until the drains come out. And I'm going to show you the drains in just a minute. Position that you sleep in. With the abdominoplasty, you are going to be bent over like a little old lady for probably that first week. The one thing you never do is try to help yourself stretch. Your skin will do that all by itself. So at home, and even here in recovery, they're going to have pillows under your knees, they're going to have pillows under your back, so there is zero tension on the incision line. And then when they get you up, you're going to be wearing some old baggy clothes we talked about, maybe old baggy sweatpants. They'll just slip those on and put your zip up or button up shirt on. When you get home, even if you're going to be in the recliner, still pillows under your knees, a pillow under your back. If you're in bed, pillows under your knees, pillows under your back. Zero tension. You are okay to turn over on your side and in like a fetal position because there's no tension there. But what you're not going to do is try to stretch it out. At the end of your week, you're almost upright and it just happens. Just kind of listen to your body. If you are in the very beginning sitting in a chair and you get up and it pulls, you've not hurt anything, just readjust and go again. But usually at your 1 week, you may not be completely upright, but you're usually upright enough that the public wouldn't know it. Now, with the abdominoplasty, you do come back as a 1-day follow-up, so someone does have to drive you to that appointment. If you are staying overnight here in Owensboro, if you're from out of town, they can give you some ideas for hotels to stay in. And if you do stay in a hotel with a lipoabdominoplasty, you want to make sure, this is just a heads up, I would bring my own old sheets, old towels, so you don't mess up anything with the hotel. Even that shower curtain, lay that down so you're not getting drainage and you run a hotel mattress. And then they will get you in early the next morning for your follow-up. So number one, there's not a second day hotel charge, and then you can get on home early and not have to wait around here. As far as driving, with the abdominoplasty, it's usually about that week before you're back driving. Again, pain medicine's out of your system, you're not fuzzy-headed, you've got good use of your arms and legs, and then he's okay with that. As far as the dressing, with the abdominoplasty, of course it goes across. Now your incision, there are no stitches that you're going to visibly see. He's going to use a little skin barrier, kind of a glossy film that goes over the incision, and that's just a skin protectant. You are okay to stand in front of the sink, free-flowing sink water. That's how you're going to bathe until these drains come out. It's fine for soap and water to run down over that. Just pat dry when you're finished, and then you're going to use sterile, non-stick gauze or pads to go across the incision line. And then if you can use tape, but if you've got your panties, you can pull those up, and that usually holds that in place, and it lets you use less tape on your skin. Now, you will have sutures around your belly button though, so you need to take just a little cloth, soap and water, and just clean around there. And then again, just like with the liposuction, you'll put the antibiotic ointment, you'll put a little bit around that belly button, and then just a little non-stick gauze pad there. With liposuction, you ordered a garment. If you are having the tummy tuck, abdominoplasty, you will not order the garment, but you are going to order a binder. And I think that style number is 731, but again, they'll have that in your packet, and it'll be circled. And bring that with you day of surgery. Usually they put that on you and you wear it out the day of your surgery. But regardless, even if he didn't put it on you, bring it with you, and they'll keep it here for when he does want you to wear it. Your drains. I want to show you what they look like. I tell people I think they look like grenades. This is called a Penrose drain, and I've cut the end of it off just so I can show you this visual. It's going to be, for a lipo-abdominoplasty, you'll have two of them, and they're kind of down in this area, down around we call it the mons pubis area, but it's down below your belly button. And it will be sutured in. The one thing that is very important is that it is compressed. That means it's sucking all that extra drainage out. Of course, this is low. And in the beginning, you may be emptying it quite often. If it gets to looking like it's about getting close to halfway full, you just want to empty it because the fuller it gets, the less compression. So that means the less it's suctioning. So all you do is you're going to pop the top. This does not hurt. And you take just a little styrofoam cup. You just squeeze it out, pour it down the commode, and re-squeeze, and put the top back on. Now, in the beginning, he may not have you to do it that first night or so, but we don't know how long the drains are going to stay in. We get that question a lot. How many days do I have the drain? Well, it depends on your drainage. So it's important to have just a little pad. You'll have left and right. And what you're going to do is when you empty it, you just pop the top, and you will notice it's got numbers on it. And you're going to eyeball it because your drainage will never always hit these lines, okay? So like for instance, here's 25. It might be 30 on one side. It could be 50 on the other. But just say if I'm emptying my left side, I kind of eyeball it. I write it down, empty it in a styrofoam cup, pour it down the commode, re-squeeze, and put the cap on it, okay? Now, something that's important while you're awake, and I'm just going to hold it up so you can see it. He likes you to strip it. So this is down low, and what you're going to do is with your pinchers, like right down to where it's sutured in. With your pinchers, you'll just pinch, and then the other finger and thumb, you just push down real hard, and you just go as far down as you can go, and actually you're going from here all the way down. Now, when this drainage in a 24-hour period, here's the 25 and here's the 0. When you're about halfway in between there, that's about 15 cc's. That's what it has to be in a full 24-hour period for the drain to come out. So on your follow-ups, he's going to ask you, how much drainage have you had, in the last 24 hours? If you have your little pad, then you'll be able to tell him. Now, if you're in the beginning, especially if you're sleeping at night, no one has to get up in the middle of the night, empty these, and strip them. But if you get up and go to the restroom, it's just a good time to empty them, strip them, and then go back to bed. They're more of a nuisance to you. You will sing hallelujah when he takes these out. But until then, they are very important because they are keeping the drainage here and not here. In the very beginning, it's usually really red, and if you have them long enough, sometimes it gets to be like a little straw color, which is also normal. When the drains come out, it might be a week or so down the road, you may look down and think, gosh, it feels like there's fluid under my skin. That could be a little collection of just serous fluid. It could also be a little blood collection, hematoma. Not an emergency, but just call the office and they'll have you to come over in an appointment and he'll just check it to see. And if it is, he just takes care of it right in the treatment room. It's not a big deal. But it is important you don't sit on it for weeks if you think you do see that. One thing Dr. Eds does want you to do, morning of surgery before you come over here, he does want you to shave all the way down. A lot of women shave anyway, but if you don't, go ahead and do that morning. Wear in or bring in your panties or bathing suit bottoms that you would like to wear. You may be wearing granny panties now. Well, after surgery, you're probably not going to want to. So just look if you don't have something that you already are in and bring them in, because what he's going to do before surgery, he's going to mark where your band is. And that way he'll try to keep your incision under your band. Just don't bring in a string bikini or string underwear because he can't be that accurate. But if you've got something about like that, that's good. Now, dog ears. That is something that would occur after surgery. The day of surgery, when he's all finished, you're nice and flat. But what if the very edge of your incision over the next month, it feels like it's a little pucker? That's why it's called like a little dog ear. You may have it on one side or both sides. If you do, it could be 6 months down the road. He will revise that as a little office surgery, and there's no additional cost for that. We don't see it often, but we never know about somebody's skin elasticity. But number one, he won't touch it until he knows you're finished getting to where you're going to go. And it may not even occur anyway. And then again, at the very end of this, you will sign and date and then put it in with your consent forms, either mail them or drop them off at the office. And the last thing I would say, remember, this is just the nursing care and it's just for education purposes. If you have any questions, we want you to call the office and we will absolutely get your questions answered. And it has been a pleasure speaking with you. Thank you.